system.
Thank you,
Through a combination of things, if you look at the cost of healthcare reform, about half of it is paid through savings that range from subsidies to eliminating fraud, waste, and abuse. About half of it is paid through premiums and surcharges into the system. And in addition to increasing the overall coverage, which will impact your insurance premium. The average insurance premium includes over $1,000 a year. That really has to do with the cost of covering the uninsured, because we don't not give the uninsured health care in this country. So if you don't have Medicaid or you don't have Medicare, you still cost the system money. And all too often, you cost the system money in the emergency room or some less than ideal setting where it's more expensive. So in addition, you begin to create a downward pressure on costs through the public option, and you eliminate that cost shifting that currently goes on, where all of us are still paying for health care for the uninsured. We're just not doing it in a very efficient way.
Are there any other panelists who would like to add something to the answer?
Mr. Gessie?
I just want to say a few words about Medicare and the problems that it faces. An $89 trillion unfunded liability, that's the gap between what taxpayers are paying in and what is paying out for the life of the program as the actuaries see it. I think it's 60 years or 80 years. Then there is the fact that 40% of doctors don't accept Medicare because of the cost shifting issue, which is very real. When Medicare underpays, physicians don't like that, and they often will say, no, I don't want to accept you, and that's the same for Medicaid. And then the plan that Obama, the 3,200, that is a $1.6 trillion in additional spending, so we're not saving any money with that. And that doesn't even start until 2013. The taxes start immediately on passage. 2013 is when the health care actually starts. So it's a fatally flawed plan. And the gap only gets bigger as time goes on, because that's a 10-year window we're talking about. So I agree with you and your perspective. Thank you.
Dr. Richards, do you want to say something about that?
Yes, I'd like to build on one of the comments that was Representative Heinrich made about the fact that uninsured do receive some health care. And speaking from the perspective of emergency medicine, about 50% of all the patients that seek care in my particular emergency department, and about 25 to 30% nationally, do not have health insurance. So we pay for that care some way, and it happens through cost shifting, but we pay for it through lots of other ways. You pay for it by long waits in your emergency department. You pay for it by very difficult to understand bills. You pay for it by other means too. So for example, in my particular emergency department, the physicians there provided about $8 million of uncompensated physician care last year. So who else pays for that? The physicians do too. For example, in my particular emergency department, that results in lower wages, longer hours, and in fact, those physicians are in the lower quartile of compensated physicians nationally. So we all pay for this. Whether you have insurance or you don't have insurance, this care is allowed. In fact, it's even mandated federally through the Emergency Medicine Active Labor Treatment Act, EMTALA, which says that anyone can seek care through an emergency department. So we do, in fact, have to pay for this services some way. The problem with allowing it to happen in the emergency department is that it's incredibly expensive. So most folks would say that care provided in an emergency department is 3 to 4 times more expensive than care provided in other non-acute venues.
Thank you, Dr.